Discuss about 2023 ICD 10cm coding guidelines for neoplasms, which comes under chapter 2, part 1. So the chapter 2 of ICD 10cm contains the code for most benign and all malignant neoplasm. Certain benign neoplasms such as prostatic adenomas may be found in specific body systems, and proper documentation should be present in order to code the neoplasms. To properly code a neoplasm, it is necessary to determine from the record that whether the neoplasm is benign or in situ, malignant, or of uncertain histological behavior, and if malignant, whether it is primary or secondary. That must be determined. Now, primary malignant neoplasm overlapping site boundaries. A primary malignant neoplasm that overlaps two or more contiguous, that is next to each other sites, should be classified to the subcategory .O, overlapping lesion, unless the combination is specifically indexed elsewhere. The primary malignant neoplasm that overlaps two or more contiguous, that is continuous sites next to each other sites, should be classified as overlapping lesion. And for multiple neoplasms of the same site that are not contiguous, such as for example tumors in different quadrants of the same breast, then you need to code for each quadrant when there is specific code. Coming to malignant neoplasm of ectopic tissue. Malignant neoplasm of ectopic tissue are to be coded to the site of origin mentioned. For example, ectopic pancreatic malignant neoplasm involving the stomach are coded to malignant neoplasm of pancreas unspecified. The malignant neoplasms of ectopic tissue are to be coded to the site of origin mentioned. Here, ectopic pancreatic malignant neoplasm. The site of origin is pancreas. So the proper code is C25.9, which is nothing but malignant neoplasm of pancreas. Now coming to referring the index and table. The neoplasm table in the alphabetic index should be referred first. In the alphabetic index, there is a specific table called neoplasm table. So whenever we are coding neoplasms, first we must refer that table. However, if the histological term is documented, then the term should be referred first rather than going directly to neoplasm table. For example, in order to determine which column in the neoplasm is appropriate, if the documentation indicates adenoma, first you need to refer adenoma in the alphabetical index. There you can see an instruction note. See also neoplasm by site benign. So then you need to go to neoplasm table and you have to see the benign neoplasm that for that particular site. Whenever adenoma is mentioned, you need to refer benign neoplasm. And the table provides the proper code based on the type of the neoplasm and the site. Here is the list of entire topics that we are going to discuss in the neoplasm chapter. There are around 20 odd topics. So the first one is admission or encounter for the treatment of primary site. The next is admission or encounter for the treatment of secondary site, coding and sequencing of complications, primary malignancy previously excised, admissions or encounters involving chemotherapy, immunotherapy and radiation therapy, admissions and encounter to determine the extent of malignancy, symptoms, signs and abnormal findings listed in chapter 18 associated with neoplasms, admission and encounter for pain control and management, malignancy in two or more non-contiguous sites, disseminated malignant neoplasm unspecified, malignant neoplasm without specification of site. Next is sequencing of neoplasm codes, current malignancy versus personal history of malignancy, leukemias, multiple myelomas and malignant plasma cell neoplasms in remission versus personal history, aftercare following the surgery for neoplasm, follow-up care for completed treatment of a malignancy, prophylactic organ removal for the prevention of malignancy, malignant neoplasm associated with transplanted organ, breast implant associated anaplastic large cell lymphomas, and finally secondary malignant neoplasm of lymphoid tissue. This is a new guideline. Secondary malignant neoplasm of lymphoid tissue. This topic we will be discussing in the part 2. First, coming to admission or encounter for treatment of primary site. If the malignancy is chiefly responsible for occasioning the patient's admission or encounter and treatment is directed at the primary site, designate the primary malignancy as the principal or first listed diagnosis. In simple words, if the malignancy is reason for visit and treatment is directed at primary site, then you have to designate the primary malignancy as the PDX. The only exception to this guideline is if the admission or encounter is for chemotherapy, immunotherapy or external beam radiation therapy is chiefly responsible for occasioning the admission or encounter. In this case, appropriate codes from the category Z51 dot, this is further expandable, should be coded as first listed or principal diagnosis, and the underlying diagnosis or problem for the service is being performed should be assigned as SDX. Next is treatment directed towards secondary site. When the patient is admitted because of a primary neoplasm with metastasis and the treatment is directed towards the secondary site only, then the secondary neoplasm is designated as the PDX even though primary malignancy is still present. Reason for visit should be considered. If the treatment is directed towards the secondary site, then secondary site or secondary malignancy or the metastasis should be the PDX followed by primary malignancy. Let us see an example. A patient with primary prostate cancer with metastasis to lung presents for wedge resection. Here the primary malignancy is prostate cancer and it is metastasized to lungs. But the reason for visit is for wedge resection, that is to treat the lung cancer. So here the PDX should be the secondary malignancy, that is C78.01, secondary malignant neoplasm of right lung, followed by C61, malignant neoplasm of prostate. Now coming to coding and sequencing of complications. In the coding and sequencing of complications, there are 4 subtopics. Anemia associated with malignancy, anemia associated with chemotherapy, immunotherapy and radiation therapy, management of dehydration due to the malignancy, and treatment of a complication resulting from a surgical procedure. First, coming to anemia associated with the malignancy. When the admission or encounter is for the management of an anemia associated with malignancy and the treatment is only for anemia, the appropriate code for malignancy is sequenced as PDX followed by appropriate code for anemia such as D63.0, anemia in neoplastic disease. Whenever anemia is associated with malignancy and the reason for visit is treatment of anemia, even then cancer or malignancy should be the PDX followed by anemia code. Let us see an example. A patient is seen for the treatment of anemia in advanced primary liver cancer. Here PDX should be primary liver cancer, that is C22.8, malignant neoplasm of liver, primary, unspecified as to type, followed by D63.0, which is nothing but anemia in neoplastic disease. Coming to anemia associated with chemotherapy and immunotherapy. When the admission or encounter is for the management of an anemia associated with an adverse effect of administration of chemotherapy or immunotherapy and the only treatment is for anemia, then anemia code is sequenced first, followed by the appropriate codes for neoplasm and the adverse effects. Whenever anemia is associated with chemotherapy and immunotherapy and treatment is directed towards anemia only, Then first you need to code the anemia code followed by adverse effect of anti-neoplastic and immunosuppressant drugs. Here you can see the adverse effect of anti-neoplastic and immunosuppressant drugs. Initial encounter T45.1x5A, D indicates subsequent encounter, S indicates sequel. Now let us see an example. A 56-year-old Hispanic male with grade 2 follicular lymphoma involving multiple lymph node sites referred for blood transfusion to treat anemia due to chemotherapy. So here reason for visit is treatment of anemia, that is blood transfusion. So first you need to code the anemia code as PDX. D64.81, anemia due to anti-neoplastic chemotherapy, followed by C82.18, follicular lymphoma grade 2, lymph nodes of multiple sites. Then T45.1x5A, that is adverse effects of anti-neoplastic and immunosuppressant drugs, initial encounter. Now, anemia associated with radiation therapy. When the admission or encounter is for the management of an anemia associated with an adverse effect of radiation therapy, the anemia code should be sequenced first, followed by appropriate neoplasm code and code Y84.2, which is nothing but radiological procedure and radiotherapy as a cause of abnormal reaction of the patient or of later complication, without the mention of misadventure at the time of procedure. Let us see an example. A 55-year-old male with large malignant rectal tumor has been receiving external radiation therapy to shrink the tumor prior to planned surgery. He is referred today for blood transfusion to treat anemia related to radiation therapy. So first anemia should be sequenced first, D64.89, other specified anemias, followed by neoplasm code, that is C20, malignant neoplasm of rectum, followed by Y84.2. Now coming to management of dehydration due to malignancy. When the admission or encounter is for the management of dehydration due to malignancy and only dehydration is being treated via intravenous dehydration, the dehydration is sequenced first, followed by the code for malignancy. Let us see an example. Patient treated for dehydration due to gastric cancer. So first dehydration code is coded E86.0, followed by C16.9, malignant neoplasm of stomach unspecified. Now treatment of a complication resulting from a surgical procedure. When the admission or encounter is for the treatment of complication resulting from a surgical procedure, designate the complication as the PDX if the treatment is directed at resolving the complication. Complication should be sequenced first. Now let us see a table here. Anemia, these are the complications, sequences and the appropriate codes. Whenever anemia is associated with malignancy, the treatment is only for anemia. Then the appropriate code for malignancy is sequenced as PDX followed by code for anemia. Second case, anemia associated with chemotherapy, immunotherapy and radiation therapy. Whenever anemia is associated with an adverse effect of administration of chemotherapy or immunotherapy, anemia code is sequenced first, followed by neoplasm code and adverse effect code T45.1x5, either A, D or S, adverse effect of anti-neoplastic and immunosuppressant drugs. And whenever anemia is associated as an adverse effect of administration of radiation therapy, here also anemia code is sequenced first, then the neoplasm code, then Y84.2, which is nothing but radiological procedure and radiotherapy as a cause of abnormal reaction of the patient. Now coming to management of dehydration due to malignancy. And only dehydration is treated via intravenous rehydration. Then dehydration is sequenced first, followed by the code for malignancy. Next is treatment of complication resulting from a surgical procedure. Whenever complication results from the treatment of a surgical procedure, complication should be coded as the PDX if the treatment is directed towards resolving the complication. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.